If you wouldn't mind, could you dive a little bit deeper into the full results of the study and what the study population was like?
Yeah, so the Brace Corona study was a multi-center phase 4 randomized trial testing two strategies: temporarily stopping the ACE inhibitors and ARBs for 30 days, or continue these drugs in patients who were taking chronically these medications for hypertension or for heart failure, but who also were hospitalized with a confirmed diagnosis of COVID-19. So that's basically the population. We randomized 659 patients across 29 hospitals in Brazil. And the primary endpoint of the study was the number of days alive and out of the hospital at the end of 30 days. So this was basically the design. And in terms of the primary endpoint, we shown that the mean number of days alive and out of the hospital was 21.9 days for patients where the ACE inhibitors and ARBs were stopped, and 22.9 days for patients who continue these medications, with a mean ratio of days alive and out of the hospital between the suspending and the continuing groups of 0.95 with a p-value of 0.09. So really, we do not find a significant difference in the number of days alive and out of the hospital between the two strategies that were tested in the Brace Corona trial.
All right, so based on that, your determination would be that unless there's a specific reason to, there's no benefit to discontinuing ACEs and ARBs therapy in these patients?
That's exactly right. So because our data, it really indicates that there is no clinical benefit from routinely suspending these medications, at least in hospitalized patients with mild to moderate COVID-19, the recommendation that they should be generally continue for those with an indication. In other words, the indication to stop, or the decision to stop or to continue the ACE inhibitors and ARB should be on an indication, on a clinical indication, irrespective of the diagnosis of COVID-19.